Okay, moving on in our upper limb, we come to the limb bone that belongs in your arm. Remember, your arm spans from your shoulder to your elbow. It does not include your forearm, which expands from your elbow to your wrist. So this is part of your arm. This is the humerus. We have a right humerus here and a left humerus over here, and we're looking currently at the anterior view of that humerus. We could flip them around and look at their posterior sides. Posterior view here. Now it's a little bit more challenging to tell what's the front and what's the back when you're looking at a humerus than it was when we were looking at the scapula. So to be able to tell front from back, we're going to start off by using our right humerus, and we're going to get a little bit closer to it. We have the two different ends. We have the proximal end over here. This is the end that would attach to your shoulder, and this is the distal end. This is going to attach at your elbow joint. We are looking at the front of this humerus, and my favorite way of telling that this is the front instead of the back is by looking for this groove here. Now, when we're looking at a groove on a bone, we call it a sulcus. So sulcus is the anatomical name for a groove on a bone. And this sulcus here is sitting between two big bumps. We have a big bump here, which is called the lesser tubercle. And then we have a huge bump here. Golly gee, look how big this thing is. Huge. This is our greater tubercle. And in between those two tubercles, we have a groove, and that's called the intertubercular groove. Inter means between. So intertubercular, between the tubercles, between the lesser tubercle and the greater tubercle. And we can only see that groove on the anterior side of the bone. The other way that we can tell that this is the anterior side of the humerus is we move down to the distal end of the bone. And on the distal end of the bone, I see two structures. I see something that's very rounded, looks kind of like a head. That's called the capitulum. Capit means head. Think about what you wear in your head. A cap, right? A ball cap. Cap means head. If you decapitate someone, you take off their head. So capitulum means head. And the head of the radius is going to articulate there. This here is called the trochlea. Trochlea is Latin for pulley, and someone looked at that and thought it looked like a pulley. So right here, that trochlea. And that's going to attach to the trochlear notch on the ulna. So my radius attaches here and my ulna attaches there. We can see both of those really clearly from the anterior view, but if you flip it over to the posterior view, really we're only seeing the trochlea. The other big thing that we see in the posterior view that we didn't see in the anterior view is this depression. And remember that a depression on a bone is called a fossa, and that's the olecranon fossa. It's where your elbow, your olecranon process, your elbow, is going to fit when you extend your arm. All right, so let's flip back around to the anterior side of this bone, and we're going to go through some structures. Starting at the proximal end, and then working our way towards the distal end here. So up at the proximal end, the smooth spot here is called the head, and just below the head we have the neck. So the neck sits just below the head. This is called the anatomical neck, right there, just under the head. We do have a surgical neck, which is located here as the bone starts to thin. So an anatomical neck versus a surgical neck. Again, our two tubercles, the lesser tubercle, and then out here, the greater tubercle, so large, and between the two, an intertubercular groove. Now, all those bumps are very important because eventually we're going to start attaching muscles to them, and we're going to start attaching ligaments to them as well. I'm going to move down the shaft of the humerus, and what I find is a large rough spot on the bone here. It's almost V-shaped. This rough spot is called a tuberosity. We're going to see several different tuberosities. This one is called the deltoid tuberosity, named for the deltoid muscle that attaches here. Moving down to the distal end of the bone, this would be the end of the bone that attaches near your radius. It's your elbow joint. We're going to get nice and close to this part of the bone. Again, we see our capitulum, and we see the trochlea. Capitulum for the head of the radius, and then the trochlea is where the ulna is going to attach. Now, technically, what we're seeing here is the medial and the lateral condyles. Condyle is a rounded part of the bone that will articulate with typically a depression on the other bone. So let's look at this. Again, this is my capitulum. And what I'm going to do is bring in my radius here, and you can see how the radius attaches there at that capitulum. And then the radius can rotate, which allows you to flip your hands over. We call that pronation and supination. So we're going to leave this here. My trochlea is the attachment point or articulation point for this bone. This is my ulna. And see how the ulna has this big sort of U-shaped notch in it? That's called the trochlear notch, and it's going to fit directly into this trochlea. So let's see if we can make that work. Oh, there it goes. Fits right in there. So now I can move my elbow joint. It makes a nice hinge joint. The other thing that I notice is that just above those two smooth spots, those two condyles, my capitulum and my trochlea, I have a big rough spot on the inside and then a smaller rough spot on the outside. These are called the epicondyles. Epi means above. So epicondyles, above or upon. We have a lateral epicondyle here and a huge medial epicondyle here. Fun anatomical fact, you have a nerve called the ulnar nerve that wraps right around that medial epicondyle, and it's also very superficial. You can feel it on the inside of your elbow. So feel on your own elbow, reach down there, and feel on the inside or medial surface of that ulna. You should feel something sticking out. That's the medial epicondyle, the humerus. And running right around the back side of it is the ulnar nerve. And if you bump that medial epicondyle of the humerus, they call it hitting your funny bone, right? Although it is not humerus at all, it hurts like heck. You'll get a shooting pain in that ulnar nerve, which is going to shoot down the forearm and into the hand. Fun fact about a medial epicondyle. How can you tell medial from lateral? Oh goodness, that's not easy until we step back. And if we take a step back here like so, we can see that that medial epicondyle is on the same side as the head. And that head has to be medial because it's going to attach to your scapula, which is medial. All right, let's zoom back in to our distal end of our bone. Again, we're still on the anterior side, still on the front. And what I see here is a depression. Remember that a depression on the bone is called a fossa. And this particular fossa is called the coronoid fossa because that coronoid fossa is going to receive this process here, which is called the coronoid process on the ulna when your arm bends. So let's see what that looks like. Okay, I put the two together. And again, this is my coronoid process. And when I bend my elbow, here, you can see how that coronoid process is fitting right into the coronoid fossa. Kind of snazzy. And then our trochlea and trochlear notch are fitting together. Now I want to take this humerus and I want to flip it over to the posterior side. On the posterior side of the distal part of this humerus, I have a huge fossa. That's the olecranon fossa. And that olecranon fossa is named for the process that fits into it. Again, I have my ulna here, and I have this big process here. This is my olecranon process. This is the part of your bone that you would set down on the table if you were putting your elbows on the table. So do that for me. Put your elbow down like you're putting it on the table, and what you're actually resting your elbow on is the olecranon process. So next time someone fusses at you to get your elbows off the table, you can say, oh no, it's my olecranon process. And they will be so impressed that they will totally forget that you had your elbows on the table in the first place. Maybe. What's the purpose of this olecranon fossa? It's to receive here the olecranon process. So the olecranon process, which is part of my ulna, fits right into that olecranon fossa.